My name is Dr. Syed. I'm a medical doctor of experience of 8 years so far in the field. First of all, breast cancer, right? Breast cancer itself is an abnormal growth, multiplications of tumor cells on our breast, normal cells that become cancerous cells, right? So they end up forming symptoms in the form of breast lumps, usually. So they often happen anywhere around the breast, so the symptoms that you have to watch out are for those lumps. They can be sometimes painful or even painless, no pain at all, and they sometimes have this orange-like texture on them. Otherwise, in the French, we call it peau d'orange. It's like a texture like an orange, yes. Other than that, right, there might be symptoms of enlarged lymph nodes. Lymph nodes are actually these small beans that are part of the immune system. They can be grown up, they can also enlarge in size in breast cancer as well, alongside the tumor lumps, basically. Other than that, some patients might actually have symptoms of chronic fatigue, as in like they're feeling tired all the time, losing a lot of weight, But of course, these symptoms have to be correlated together with the breast lumps. That's the number one symptom usually, breast lumps. Yeah, those are the first initial symptoms. So we want to learn about how to prevent breast cancer. Right? That's very important. We have to prevent. We have to understand why it's happening in the first place. Why does it happen? Right? Just like we talked about the tumor growths. Why does the tumor growth happen? Isn't it? It's mostly because in the case of breast cancer, abnormal cells. Right? Why does the cell become abnormal? Right? The reason is, it sounds very typical, I know, but it comes back to our diet, our lifestyle, right, and what we consume, and even our genetics sometimes. So for example, if you are having a diet which is very unhealthy, full of fried foods, cancerous, basically carcinogenic food that can cause cancer, like fried foods, unhealthy foods, right, basically too much of processed meat, like meat patties and burgers, maybe an improper lifestyle, full of stress, too much stress, not enough sleep, or you're always just sitting down all the time, you're not moving around, all these can contribute towards the cells becoming abnormal over time. But of course, don't forget about genetics. If you have a family history of cancer in your family, your mom or dad or your basically your mom, mostly the woman, grandma, grandpa, grandmother and all that have breast cancer, the chances of you getting breast cancer is high. So how to reduce the prevention, right? You said how to prevent. Yeah. Number one, even before you go for a mammogram, which is the checking, the scanning for breast cancer, which can really help, by the way. Before you do all that, always check your own breast. Always check your own breast. So for breast cancer, basically, if there was a breast here, let's just assume that, okay, this is a good example. Okay, this is a breast, all right? Okay, this is the breast. Okay, so basically, you have to palpate whenever you can, like every few months, to check from inside the circular region all the way outside the breast, including under your arms as well, and even here as well. Okay, if you feel any like a bean-like structure, something like this, you're feeling something, something here or even here, that's not good. You have to check that out, right? Now, if you have a strong history of breast cancer in the family, right, in your mom and dad's, or mom's side, usually your grandmother's side, mammogram is really good. A mammogram can detect whether you have cancer. That's one thing. If you have, coming back to your question, how to prevent again, right? If you have someone who has, your mother or grandmother definitely has breast cancer in your family, you can go for something called genetic testing, called BRCA testing, to check for any BRCA genes. Do you know who else got BRCA genes in the world and actually removed her breast by herself? Angelina Jolie, Hollywood actress, very famous, right? She actually took out her own breast because of the risk in the family was so high, she was so scared. And rightfully so, because we don't want, most unfortunately, based on the statistics in Malaysia, 50% of breast cancers are diagnosed only at stage 3 and 4. Do you know what that means? That's very bad. Stage 1, 2, 3, 4. If you detect cancer at the first 2 stages, you're okay. You can still save. 3 and 4, very bad. Very bad. It can cause death. So those were the steps that you can take. Always check yourself. Always do a mammogram if you are in the high-risk category. Usually, if you don't have cancer in your family, 40 years and above, your age, 40 years and old, you have to check for breast cancer through mammogram. Or of course, if you're not confident, you're not sure, right? Always see a doctor. Always see a doctor to find out and scan for you, see for you, talk to you, find out whether you have breast cancer. So the thing is, when you talk about breast cancer, right? Obviously, we're thinking girls, females only, right? Of course, but that can be so wrong actually, because even men can develop it. Which kind of men can develop breast cancer? Most of the time, men who are obese, who have genetic problems like the BRCA gene mutation I mentioned just now, and even something like Klinefelter syndrome. It's basically where the estrogen is too much in the body. There's a small little information I forgot to mention earlier, is that when I was talking about lifestyle, right, to make your exercise okay, your diet okay, it's also because of estrogen. Estrogen is a hormone in the body. Our female, even the female and male has estrogen inside. The estrogen is very good to make your breasts become bigger, that sort of thing, and also for the hormone, for your menses, it's very important. But what if it's too much? Too much. And you know why it's too much? Even the men also can have too much, which is not good, because of the diet outside. All the food outside, the processed foods, the over-fried foods, and the dirty oil, the burgers which are over-processed meat, which is sometimes fake meat, real meat, I don't know, that can all increase your estrogen. Stressful lifestyle, you sleep 3-4 hours a day, all this can affect your hormones, So for the men, that can happen too. And that's why it's so shocking that even sometimes some men have breast cancer. It's so weird. But it can happen. It can happen. And another thing is, specifically for certain men that are using pills, if you know what I mean.
Yeah.
They're using pills, and no judging, we're not judging anyone. It's just that these pills, hormonal pills, to increase the breast size for the men, some of them do it, that can cause it too. That can cause development of breast cancer, because there was no breast tissue in the beginning. You're making it happen. Yeah, exactly. So, yes, men can get breast cancer too, and they must check themselves also as well. And don't forget, if you have a strong history of breast cancer in the family, just be careful. Be careful.